Scene 1, 8 a.m. at Sec.1Group Hospital.
The patient Mrs. Somporn-Namwong, who is diagnosed with right renal calculi, is admitted into 4C ward. The nurse named Sitang is going to interview the patient on the first day of admission.
Good morning, Mrs. Namwong. My name is Tang Tong. I'm a nurse. How are you today?
I don't feel good.
I'm sorry to hear that. What brings you here today?
A couple days ago, I started having blood in the urine, burning on urination, urinary frequency, high fever and chill.
I see. May I take your vital size, please?
Sure.
Your blood pressure, pulse, and respiration rate are normal. Your temperature is high. I would like to do physical examination on you. Do you have pain?
Yes.
How much pain do you have? If pain score is from 0 to 10, 0 means no pain at all and 10 means severe pain.
I think around 6.
I will notify doctor. Please take a rest. The doctor will come to see you soon.
Scene 2. After the doctor came to see the patient and gave the order, the nurse is coming to talk to the patient.
Hello, I would like to tell you about the doctor's order. Today you will be examined for urinary analysis, urine culture, blood test, CT scan at abdomen, and KUB X-ray. Now I will take your blood and collect your urine. Then I will send you to the X-ray room.
Okay.
Scene 3. The nurse is coming to tell the results to the patient.
Hello, Mrs. Namwong. I would like to tell you about the results of examination. The KUB and CT scan show that you have stones in the right kidneys. The laboratory results show that you have a high level of white blood cells in your blood and urine. Also, the urine culture shows bacterial infection. To remove the stones, the doctor will perform percutaneous nephrolithotomy or PCNL. However, now you are having the problem with infection. The doctor will prescribe antibiotics for you after the infection is treated completely, which will take about 7 to 10 days. You can come back for PCNL.
Okay, thank you.
You are welcome.
10 days after taking antibiotics, the patient is free from infection and comes back to the hospital for PCNL. The nurse is talking to the patient on the day before the surgery. Hello, Mrs. Namwong. Regarding your diagnosis of right renal stones, you will have a surgery at 10 a.m. tomorrow. Before that, I would like to explain about the surgery, which is called PCNL. Do you know what it is?
No, I don't know.
It is a technique for treating kidney stones. Before PCNL, you should get enough sleep and abstain from water and food for at least 6 to 8 hours. During PCNL, you will be under general anesthesia, so you will be asleep and not feel any pain.
Okay, what will happen to me after PCNL?
You will be checked vital signs frequently and retained a Foley catheter to check for blood in the urine and to record intake output. It will be removed prior to discharge. You will have a nephrotomy tube which is put in to drain your urine directly from your kidney to the drainage bag. There is a possibility that you will be discharged from the hospital with the nephrotomy tube.
Okay.
Moreover, you will be checked at the surgical site for bleeding and pain. If you have a lot of blood coming out from the site, please notify nurses immediately. And if you feel pain, you can ask for the pain-curing medication. The side effects of general anesthesia, like Nausea and vomiting may occur after the surgery.
How long do I have to stay in the hospital after the surgery?
It should be approximately 1 to 2 days. Do you have any more questions?
No, I don't.
If you agree to have PCNL, please sign in the consent form.
Okay.
Today, Mrs. Namwong will go home with a nephrostomy tube. The nurse is going to educate her and her daughter.
Hello, Mrs. Namwong. My name is Jane.
Hello, Jane.
A doctor has ordered you to go home and you will go home with a nephrostomy tube. Today, I will tell you and your daughter how to care for the tube. You have to inspect your tube and empty urine in the drainage bag into a toilet when it's approximately halfway full on a daily basis. You typically need to flush your tube at least once a day.
Okay, so what next then?
You also have to look at the dressing, checking whether it is dry, clean, and secure. If it's wet, dirty, or loose, it will need to be changed, and you need to change at least once a day in 2 weeks after nephrostomy tube placement, and then once in 3 to 5 days.
Okay.
The steps of wound dressing include wash your hands with soap and water, remove the wound dressing, clean a tube with saline, and then clean skin around the tube. Place one piece of white gauze under the button and cover by gauze, and use a small piece of tape to keep the gauze in place.
I understand.
I'm glad to hear that. By the way, there is something that you have to be cautioned.
What is it?
The most common complication that you are likely to encounter is infection. You should contact your doctor immediately if you experience the following symptoms, like a fever, pain in your side or lower back, swelling, redness, or tenderness at the site of your dressing, urine that is pink or red, because it means you may have an infection.
How can I prevent infection?
You should keep the bag that is connected to the tube securely in place. Be sure to keep the drainage bag below the waist to prevent urine backup. Be sure you wash your hands before and after changing dressing and avoid the dressing wet.
I got it.
Do I need to have the tube permanently?
No, normally it takes about 1 to 2 weeks following surgery.
Okay, thank you.
After the patient underwent PCNL, nurses are going to do a pre-conference, give a shift report, and write a nurse's note. Good morning, everybody. Today we are going to do a pre-conference of the patient bed number 6, Mrs. Somphon Namwong, age 60 years old. She was admitted with right renal calculi and underwent PCNL on May 30th, 2020. After the surgery, she has nausea and vomiting 4 times and is unable to drink and eat properly.
That sounds bad. What about laboratory results?
Before the surgery, serum sodium and potassium levels were normal, but after the surgery, serum sodium and potassium levels are lower than normal.
How many days that the patient has nothing per hour?
For a couple days.
What treatments had the doctor ordered?
The doctor has ordered metoclopramide 20 mg injection for nausea and vomiting, and 5% of dextrose in sodium chloride 1000 ml, plus potassium chloride 30 ml equivalent per liter. When drip 80 ml per hour to replace calories, fluid, and sodium and potassium loss. If the patient feels better, intravenous fluid will be off and she will start eating liquid diet, soft diet, and regular diet as tolerate, respectively. What can be a nursing diagnosis for this problem?
In my opinion, electrolyte imbalance related to nausea and vomiting many times can be a significant nursing diagnosis at this moment.
I agree.
I couldn't agree more.
What do you think should be nursing objectives for this problem?
The patient decreases nausea and vomiting and can start eating.
May I add more?
Yes, of course.
The patient has no symptoms of hyponatremia and hypokalemia and will sustain normal serum sodium and potassium levels.
I agree.
What are nursing interventions that we should provide to the patient?
First of all, I think we should monitor the patient's vital signs and assess signs of hyponatremia and hypokalemia.
I agree. Medications and intravenous fluid must be administered as ordered. And we should continue observing nausea and vomiting. If they're still present, we should notify the doctor.
Don't forget to exceed for calories whether they can reach the body requirement or not. And when the patient is able to eat, we should advise her to eat small amount of food each time but more frequently.
Right. We should also advise the patient to drink water adequately to prevent dehydration.
Intake and output should be monitored and recorded, as well as laboratory results, especially serum sodium and potassium.
Do you have more suggestions?
No, I don't.
No.
No.
Okay then, thank you.
Scene 2. Change of shift report at 4 p.m.
Good afternoon, everybody. I am going to give a report of the patient bed number 6, Mrs. Somphon Namwong, who was diagnosed with right renal calculi and underwent PCNL on May 30, 2020. As the patient's serum sodium and potassium levels are low, due to nausea and vomiting, our nursing diagnosis this morning is electrolyte imbalance related to nausea and vomiting many times. At the end of the morning shift, the patient's vital signs are normal and stable. She has no signs of hyponatremia and hypokalemia. Medications and intravenous fluid are administered as ordered.
Does she have nausea and vomiting?
She still has nausea but no vomiting and started having a liquid diet. She could eat it quite well, so that in your shift she should have a soft diet.
Did you check for her electrolytes again today?
Yes, I did. The results show that serum sodium and potassium have turned to the normal level.
Wonderful! We will continue doing nursing interventions as planned in our shift.
Okay.